New at 10, nurses and healthcare workers on the front lines of the COVID pandemic are not just facing added stress. A new study shows these workers are facing trauma. Many are already exhibiting at least one symptom of PTSD. Rebecca Clough talked with one nurse about her experience and area hospitals about what they're doing to help healthcare workers through this unprecedented time.
It's been nearly a year since the Milwaukee VA hospital saw its first COVID-19 patient. Dawn Kruger, a staff nurse, has been there since the beginning. Each patient, a face, a name that stays with her.
Can't forget them because it was something that was totally new, something we had not seen. How rapidly these patients were deteriorating.
And it's taking a toll on frontline workers. More than 400,000 Americans have died of COVID, and even more have been hospitalized. The chief nursing officer at Advocate Aurora says this is very different than what nurses are used to.
We see illness and death in our jobs all the time. We're trained, we care for people at all stages of their life. But our team members, our nurses have seen more death over this past 9 to 10 months than they have in the past.
In Milwaukee County, during the second surge of cases, an average of 9 people died a day from COVID.
It's been unrelenting. And I think that's the other piece there. You know, we're used to working in crisis, but usually we'll have a break from that crisis. And this, in many cases, has continued.
Dawn feels the weight of being with each patient at the end of their lives when their families can't.
That is the hardest part. That is, because I don't want to cry because it's like you think of that and then immediately, one moment, sorry. But that is because you may be the last face that someone sees before they're intubated, and they won't see anybody else. They won't see their loved one. It's the nurse. So it's hard.
A study led by researchers at King's College London, published in the Journal of Occupational Health, found half of healthcare workers in COVID units reported symptoms consistent with post-traumatic stress disorder.
I think some of the initial things that people reported were feelings of certainly acute stress. We had people reporting problems sleeping. People reported irritability.
The VA's history of working with members of our military allowed them to anticipate the need for mental health help early on in the pandemic. Psychologist Allison Minkin set up a quiet room for people to take a mental break. It is staffed with therapists available to talk at a moment's notice.
There are so many of these feelings that go unsaid, and what that can do, unfortunately, is sometimes perpetuate some of the mental health symptoms that come with those feelings. So talking about it is the first step, and acknowledging it.
At Advocate Aurora, they are doubling down on a program where chaplains check in on staff members. They're also starting peer-to-peer counseling and psychological first aid.
We identify individuals that are on the units. They're people that work there already. They're not external. And they receive additional training in how to identify if someone needs assistance and how to connect them with resources.
For Dawn, even though she knows the days can be hard, emotional, and stressful, she doesn't want to stop.
I asked to come here.
Why?
What you're doing really matters. And I think the tightness of the group really is important. And I think for our veterans, they need the people that really want to be there, that aren't afraid to go in the rooms and just be with them. So I think there's a bunch of us that have volunteered, and we want to be here every day.
Truly, people who are doing such important work for our community. If you or someone you know needs help, even if you're not a healthcare worker, you can get help by calling 1-800-273-TALK. Otherwise, we do have resources from the CDC on our website. Reporting in Milwaukee, Rebecca Clough, TMJ4 News.